Hello friends, welcome back to the Zone of Med, and today the topic which we are going to discuss is our sternum. Since this topic is a subdivision of our thoracic uh, skeleton, so we are going to divide this complete lecture into 5 parts. Basically the sternum which we are going to discuss today. Then we take ribs, then costal cartilages, then articulate cartilages, and finally we see about the thoracic cage, or we say the skeletal cage. So today we are going to discuss only and only about the sternum. So when we talk about the sternum, when we talk about the skeletals, you can see over here we have a complete skeletal, thoracic skeleton. So we have interiorly, you are seeing this complete orange part. This is our sternum. We have laterally the 12 pairs of ribs. Very clearly we are seeing over here. And when we talk about posteriorly, if you see, we have all the 12 thoracic vertebrae. So whosoever is asking that how the thoracic skeletal is made up of. So anteriorly we say it is sternum, then laterally it is 12 pairs of ribs, and posteriorly it is 12 thoracic vertebrae. Moving forward, now before starting, let's ask yourself these 4 questions. If you are able to answer, then it will be an awesome. If not, then let's go further. And after the completion of the lecture, just do this self-test and let me know how much you're able to recognize things. So when we talk about the joints and the type, the 3 type of joints which we see. So first of all, you need to know the osteology, or we say the bones which are concerning with our thorax, or we say the sternum, which the bones which are related to sternums are basically clavicle, sternum. Then we have the parts of the sternum, that is manubrium. And then, so the 4 parts which we need to remember is sternum, manubrious sternum. Then we have a xiphoid process as well as one that is known as the clavicular. So the 3 type of joints which we need to remember is sternoclavicular. As the name suggests, this joint is between the sternum and the clavicle. We'll see forward. So it is a type of saddle type of synovial joint. When we talk about the manubrious sternal joint, it is type of hinge type of synovial joint. It is second cartilaginous joint, and it might comes in the MCQs very frequently. Xiphisternal joints, that is sternum and the xiphoid process, and it is synchondrosis. So you need to remember this slide very thoroughly. When we talk about what type of bone is our sternum is. So the another name of sternum is our breastbone. We say it is a long, you can see over here also, it is long, flat bone, and it lies superficially in the middle of the chest line. So we say it lies in the middle of the chest line. Chest line means the breast line. It is somewhat a T-shape. If you can see, it is somewhat a T-shaped structure, or we can say it is a dagger or a small sword-like structure. You can give any name, but remember it is somewhat a T-shape like structure. It is directed downwards and forward. Forward why? Because it is located anteriorly, and it is directed downwards. Why? Because it is below our clavicle. So therefore, and it forms our middle part of interior thoracic skeleton. We have discussed this. So we say its upper end supports clavicle, which is very much clear to us that clavicle is located above this part. Then in adults, we say that the sternum is about 17 centimeter. It is long in males as compared to the females. Remember this point. We also say in the adults, basically we are discussing about the facts which you need to remember. The adult sternum basically consists of the 3 parts. We see over a manubrium, which is a handle, or we say sword, or we say handle of the sword, the body, which is also known as the gladiolus, and the last part is the xiphoid process, which is a pointed part. So we say this one is the handle of the sword and this is the point part of the sword. As we say that the upper end of the sternum is broad and thick, you see over here, and the lower one is pointed and thin. And it is broaded basically at the junction of a first costal cartilage over here. First costal cartilage here you can see, and narrow at the manubrium sternal part. So these are the basic things which we need to remember. So when we come to the parts of the sternum are three. That is manubrium, which is the upper part, then middle one, that is the body, and the xiphoid, that is the lower part. When we talk about the anatomical position, just remember, you need to remember each and every anatomical position very briefly because the examiner might ask during the viva, and it is helpful also to identify the side of it. So when we talk about its anatomical position, so we say it's broad and it's directed upwards, that is manubrium, and slightly forward. You can see this forward part over here. Then it is a rough concave surface. Anteriorly, you are saying it is very rough part, and it is smooth concave surface posteriorly. So you need to remember the anatomical position, three parts of the sternum. Then we say that the upper end that supports the clavicle and the margins of the first 7 ribs. So this slide is all the things I have already discussed with you. Then we talk about the function. So the function you need to remember, it provides origin and insertion to many muscles. We'll see in the upcoming slides, and it forms interior median, like it protects our many parts that like our lungs, our heart. Then we'll see where these what part of the sternum the lungs and the heart consist of, in what part the arch of aorta descending arch of aorta is concerning. So we'll see. So till now you just need to remember it is a flat type of bone. Its position, it is light in the middle chest, and anterior part is convex and rough, whereas posterior part is concave and smooth. So moving forward, this is the mind map which I've already posted in the Telegram group, and here it is just for the revision. When we talk about the manubrium has the two surfaces and the four borders. Two surfaces are anterior and posterior. We have already discussed, like that the anterior surface and that is convex and posterior is concave. So we have discussed it. Border we say superior, inferior and lateral. But remember the MCQ came that it has a two lateral borders and one superior and one inferior border, and the superior border has two notches, that is jugular notch, which is also known as suprasternal notch, and the clavicular notch. In this you need to remember its insertion or the muscles origin from it and nothing much more about it. So this is the part which we need to just see on a broad basis. Then whatever I'm explaining you is already put it in the table form. So just focus whatever I'm saying. So when we talk about the parts, so we say it is the manubrium, it has the stern body, and it has the xiphoid process. So these three parts are the three parts of the sternum. When we talk about the manubrium is the upper part of the sternum. If you can easily locate it, that it is the thickest. If it is thickest, then it is the strongest. That is the most common thing you need to know. And when we talk about where it lies, so it lies opposite to the thoracic vertebrae. You know that till here we have a cervical vertebrae. When we talk about thoracic vertebrae, so here somewhat where the manubrium is coming, it lies at the between third and fourth thoracic vertebrae. So It is something, if you see carefully, it is a quadrangular form. So it is broadly from above and narrow from below. This you need to remember. When we talk about the anatomical function, see, I was telling you that the manubrium is located somewhere here, here at. So in this in this diagram, it is very much clear to you where this is the posterior view. We all know that there is 12 thoracic vertebrae. When we talk about the thoracic vertebrae, we say it is here, this one, third and fourth. So here we have third thoracic and fourth thoracic. So this part here we have our manubrium sternum. So this part, I hope it is clear to you all. Moving forward, we have discussed the main basic part, the anatomical position of the sternum, where it lies. When we talk about the anatomical position, so first thing we see it is the broader at above and narrow at below. Then we say that the superior part, the manubrium superior part, is marked by a jugular notch. And we say it is marked by the jugular notch, you can see over here. Whereas the anterior surface is smooth and convex. We have already discussed this thing. And where it lies at the third and the fourth thoracic vertebrae. So the point to remember over here that its superior border has this sternal angle, or sternal angle is also known as the jugular notch. Now moving forward, we have seen that the manubrium has two surfaces, anterior and posterior. It has four borders, superior, inferior, and we have two lateral borders. We already discussed that the anterior surface is convex from side to side, whereas the posterior border is concave and smooth. So when we talk about borders in briefly, we say that it has the jugular or the suprasternal notch, right? And we also mentioned in the previous slide that it also has the clavicular notch. Now we see that what part, like what things are attached over here. Before going towards that, let's discuss this complete part. When we say that it has the suprasternal notch, you see over here, supra means upper part, sterna means sternum, and notch means something depression like this. So it is as a suprasternal notch over here. This one, then we have the sternal angle. So we have two parts. One is suprasternal notch that lies above, and the sternal angle that is in chondrosis, which we have already mentioned. So do not confuse. I think I have made one mistake in the previous slide. The sternal angle is not supra notch. Sternal notch is not the sternal angle. Just make it correction. So suprasternal notch is above and the sternal angle is below. So this is the complete, we have already xiphoid process over here. Then we have the sternal notches. Then we have sternal angle. We have already discussed these things. So this is the broad elaboration of whatever we have discussed. So you can go through it once. When we talk about the attachments, so attachment, when we talk about the anterior surface, so anterior surface we have our pectoralis major and sternocleidomastoid. So here we have the sternocleidomastoid, as well as we have one more over here, that is pectoralis major. You can open your netters, there you can see very easily, and we already know that the pectoralis major is located on the anterior part of our chest. Then we see the posterior part. In posterior part we have a sternohyoid. You see over here, it is the sternohyoid, and we have a sternothyroid. So the two parts which we see, we say 2S on the posterior surface, 2SP, that is sternohyoid and sternothyroid. And on the anterior surface, which we have a pectoralis major and sternocleidomastoid part. So these two attachment you need to remember thoroughly. When we talk about the relations of the posterior surface, so basically the relations are very easy. We'll talk about from left to right. When we talk about the left to right, so the parts which you need to remember is that first we have a brachiocephalic vein. We are talking from left to right. We are going from here to here. So we have a brachiocephalic vein. That is, then we have our brachiocephalic artery. In this diagram, it is not mentioned properly. In further diagrams, I hope we have, but you can just open your nettles for the complete view. So then we have the common carotid artery, and the last one is we have the left subclavian artery. So we have a subclavian artery over here. Okay, then we are starting with here, that is left brachiocephalic vein. If we have a vein, then we have an artery also, then we have a brachiocephalic artery, then we have a common carotid artery. Why common carotid artery? Because we know that the heart is concerned with this part. Heart is somewhere put over here, that is why. And the left subclavian artery is also in this part. So on the lateral side, we have our lungs and the plenum. So this is the complete thing which we have discussed over here. When we talk about the jugular notches, we say that we are on a superior border, we have a jugular notch. So we have two notches, as the jugular notch and the clavicular notch. For the jugular notch, we have our intraclavicular ligaments and deep cervical fascia, whereas for the clavicular notch, the attachments which we are given is the capsule of sternoclavicular joint and the anterior and posterior sternoclavicular ligament. These all things are given in your nettles. So just open the nettle and whatever I'm saying, just try to recall all the things. Since it is a very small video, so I cannot put entire thing. Therefore, I put the important attachments only over here. So whatever I have discussed, I have put it, whatever attachments I said, I have already mentioned over. See that anterior is related to pectoralis major and sternocleidomastoid. Then posterior attachment is sternohyoid and sternothyroid. That is very important. And its relation from where we have studied, from right to left. That is, we see the attachments from here, right? From this to this. Don't say that this part is left. We are in anatomy. Our left is right and our left is right and right is left. So this here is right and here is left. So all the relations from right to left I have mentioned over here. Just go through this slide once. When we talk about the body, so the body of the sternum, we say it is a long middle part of the sternum. Then it is opposite to the 5th to the 9th thoracic vertebrae. It has the mind map which you need to remember is its surface has two parts. Anterior, posterior, it has two borders. It has a two borders, and two borders are only lateral borders, and we have upper and the lower part. So just remember this one. When we talk about this body, we say it is opposite to 5th and the 9th thoracic vertebrae. So okay, when we talk about it, here we have MANUBRIUM. From here we started with a body, and we say that the body started from this 5th, from 5th to our 9th. This complete part is our body of the sternum. Then we say um, it has anterior surface, posterior surface. It has two ends, obviously it has upper end and lower ends, and we have a lateral borders. So when we say that the body is somewhat very flat. It is directed upwards and forwards. Here we can see some transverse ridges. These ridges basically indicated sternibri. So when we talk about ridges, so here it is a complete beautiful diagram you can see over here. In body we have a sternibri, or we say that these ridges or the ridges indicates the line of fusion of four small segments called the sternibri. So we have a four sternibri in our body. Now, when we talk about the muscle attachment on the anterior surface, the muscle which is attached is the pectoralis major muscle. So, we have basically the pectoralis major muscles attaches over here. That is why we say in our manubrium also the pectoralis major is concerned. When we talk about the posterior surface, we say that the sternocostallis here, you see over here, sternocostallis muscle is attached, and the we also call transverse thoracic muscle. So in examination, if it is right, transverse thoracic muscle, it is also right, and sternocostallis is also right. This is the part you need to remember, and it is only the thing which can be asked in the exam. When we talk about the ends, it has two end, upper end and the lower end. So the upper end articulates with the manubrium. Here we have a manubrium, so here it articulates with it. And here it forms manubrium sternal joint at the level of our sternal angle. This forms a ridge. This ridge is usually palpable. So we say that the manubrium sternal joint or the sternal angle is the palpable part. This you need to remember, the palpable part of the body is the sternal angle. And when we talk about the inferior or the lower end of the body is narrow and articulates with the xiphoid process. So this articulation you can only remember by this diagram very easily. When we talk about the lateral borders, so the lateral borders have articular facets. Lateral borders, we can say we have the articular facet. Why we have the articular facet? For our costal cartilage. So here you see the costal cartilage. So it articulates with it. So when we talk about the attachments of the lateral borders, attachment of the lateral borders are external intercostalis, internal costalis muscles over here, and another one which we are having is external intercostal membranes. So the only part you need to remember over here, then we talk about the body is coming between over here. So the muscles you need to remember is our transverse thoracic muscle, which is also known as the sternocostalis, and the internal intercostalis muscle and external intercostalis membrane. So these are the attachments of it. So now coming to the xiphoid process, when we talk about the xiphoid process, we see in the diagram which we can easily see that it is the smallest and most variable sternal element. It is basically located here. We know it is the part of our epigastrium. So our xiphoid process is located in our epigastrium. So it is a MCQ can come the most variable sternal element. So we say it is a xiphoid process. Its shape is variable. It means it may be broad or thin. Here you can see it is a thin xiphoid process. Whereas here you can see it is somewhat of broad process. Therefore, we say it has a variable. So the type of variation which it can show, it can be a broad, it can be thin, pointed, bifid, curved, deflated, or we can say it can be a perforated also. Here you can see in few xiphoid process in the diagrams, you say it is a perforation also. And the xiphoid process is the cartilaginous structure. MCQ can come, the cartilaginous structure is xiphoid process. So it is continuation of our lower end. Here we have the lower end of the body and its continuation is known as the xiphoid process. So the part which we need to remember for the xiphoid process is it is a variable part, it is the cartilaginous structure. It is normally less ossified in adults, we say this thing, and it is the continuation of our lower end of the body, and it can be palpated or it is present in our epigastrium. So when we talk about the xiphoid process, okay. So the xiphoid process has two surfaces, anterior, posterior. It has one end that is upper and the border is two, that is lateral border. So when we talk about the lateral borders, so the lateral when we talk about the borders, so in the borders, when we talk about from each side, like here you can see on the either side of the upper border, there is the articulation with the inferior end of the seventh costal cartilage. So this is our xiphoid process over here. You can see clearly over here that the seventh costal cartilage gets inferiorly over here, or you can see here. This is our costal cartilage, seventh costal cartilage that is going over here. Or the better diagram which you can see is seventh costal cartilage is going in our xiphoid process. So you need to remember when we talk about the lateral borders, so in the lateral borders, we say on each side of its upper lateral border, here upper part, lateral part of the xiphoid process, there is a demifacet which articulates with the inferior end of the seventh costal cartilage. When we talk about the anterior surface, in the anterior surface, the attachment which we are talking about is the rectus abdominis. Here I don't have a diagram, but you can relate it with your letters. So in the anterior surface of the xiphoid process, here we have the rectus abdominis, medial fiber of the rectus abdominis, and the aponeurosis of external and internal oblique muscle of the abdomen. So this is the part you need to remember. When we talk about the posterior part, in the posterior part, we can see that there is the sternal slips of the diaphragm near the tip and the transversus thoracis, another attachment. Transverse thoracis is another attachment of this. So in the posterior part, we have a two attachment. One is slip of the diaphragm and another is transverse thoracis. Just correlate everything with your letters. You will have a better idea. I haven't find a pics, so I cannot put over in the slides. Moving forward, when we talk about the posterior relation of the xiphoid process, we say it is related to somewhat our left lobe of our liver. So here somewhat our liver is presented, so it is related to that. So let's recap one thing like xiphoid process. We say it is located in the epigastrium. Its shape is variable. Why? Because it can be pointed, it can be narrow, it can be perforated and more. It is cartilaginous structure. It is continued by the body of the xiphosternal joint. Its anterior surface has insertion of rectus abdominis and the aponeurosis of external and internal oblique muscle. Then posterior are the slips of diaphragms and transversus thoraces and so on. You need to remember this slide, and that's the only thing which can ask in the examination. So before starting with the sternal angle, let's quickly revise this. The attachment of the muscles which are associated with the structures to the interior surface of the sternum. So in the anterior part, we come to know in the sternal in the anterior part, we have this sternocleidomastoid, which is present over here. Here, that is arises at the upper part. Here, in the upper, from here, there is the sternocleidomastoid arises. Second is pectoralis major, which is arises from the manubrium. Then we have the rectus abdominis that is inserted in the xiphoid process. Then we have our external oblique muscles. Then we have internal interoblique muscles, which you need to remember in the anterior surface. When we talk about the posterior surfaces, we have the sternohyoid, we have a sternothyroid, we have the sternocostalis or the transverse thoracic, and we have the slip of the diaphragm. So this is the posterior attachment of the sternum, whereas the anterior attachment has sternocleidomastoid, pectoralis major, rectus abdominis, external oblique muscles, internal oblique muscles, and linea alba. In the table, you see there is the linea alba, that is the attachment to the lower end. In the lower end, here you see the linea alba. I'll put this anterior and posterior attachment in the Telegram group for better understanding. Just go over that. When we talk about the sternal angle is also known as the angle of Lewis or the manubrium sternal junction. It is the basically articulation of the manubrium with the body of the sternum. This angle can be recognized by the presence of the transverse ridge on the anterior aspect. When we talk about the sternum, we'll discuss this now. The thing you need to remember in the sternal angle is its importance. So the sternal angle is important structure, or we say the important bony landmark for thoracic anatomy. This marks the level of a number of anatomical structures. So the sternal angle is important for the anatomical structure. Here you see, this is our sternal angle. So the anatomical structures that can be is the second costal cartilage, second costal cartilage, which is attached to our second rib. You can see over in the diagram that articulates on the either side with the sternum. This is our sternum. This one is our costal cartilage, and here we have the second rib. Another one is the level of the intervertebral disc, that is from T4 to T5. Intervertebral disc, you can see over here. Then we have the plane of separation between superior mediastinum and the superior mediastinum and the inferior mediastinum. So it divided superior mediastinum over here and the inferior mediastinum over here, and the sternal angle is between. Then we have the arch of aorta, you can see in the red over here, begins and ends. Then we have the ascending aorta, we have descending aorta, then we have the bifurcation of our trachea and the pulmonary trunk, and we have the manubrium sternal joint, we have the upper limit of the base of the heart, then we have the formation of our cardiac plexus also over here. So these are the important levels of the structure. You need to remember the important one I have mentioned, and whatever I have speak, just write it down. It will be convenient for you to revise this. So the type of movement it allows is anterior and superiorly. Then it lies in the second costal cartilage. It is opposite to the T4 to T5, and it points where all ribs are counted. So all the ribs are counted from our sternal angle. These you need to remember. Moving forward, another thing you need to remember when we talk about the clinical aspect of this. So in the clinical aspect, we talk about one, that is the pigeon chest. So we say in some congenital anomaly and diseases, the sternum is abnormal. You can see over here, the sternum is somewhat very abnormal. Normal people's sternum is very flattened, but here you can see some funnel chest. The funnel you can see the bifurcated and the funnel you see. So the funnel chest, the sternum is basically depressed and in the pit. So we have two aspects. One is funnel chest, in which we have the funnel-like structure. Another is pigeon chest, in which the sternum is projected forward like the keel of a boat. So this one is our pigeon chest, and this one you can consider it as a funnel chest like part. So the when we talk about the pigeon chest, so the part of pigeon chest you need to remember is it is observed in the patient which is having the rickets. This may be due to the proliferative changes at the costochondral junction. So it is also known as the rickety rosary. So the things you need to remember in the pigeon chest is it looks like a keel of a boat. It is very common in the patient with the rickets, and it is also present. It is also known as rickets rosary. So this you need to for the pigeon chest. Another anomaly is the funnel chest. This is the funnel chest type. And in the funnel chest, the heart is pushed to the left part and the left lung is unable to expand, leading to shortness of breathing and cyanosis. So for the funnel chest, we have the cyanosis and shortness of breathing, whereas in the pigeon chest, we have the rickets and rickets rosary. So this is the part we have already discussed. It. Just try it yourself. So here I see sternocleidomastoid. When we talk about the attachments, the anterior attachments, we have already seen the posterior attachment. I told you I don't have a picture of that. So now we'll discuss here over it. This is the sternocleidomastoid. Sternocleidomastoid we see here is the manubrium, and it arises from the upper part of the sternocleidomastoid or manubrium. Then this is our pectoralis major muscles. So the pectoralis major muscle arises from the corresponding half of the manubrium, corresponding half of our manubrium over here. So this is the part you need to remember when we talk about. So you can go through this and try it by yourself. Try what is this muscle known as by yourself. So this is another one. Just go through it. What this yellow part is known as, what this white part is known as, what these structures which might help you in exam. This is the cadaveric image you need to remember. Go through it. This is the osteology which we have already discussed. Go through it once. So that is all the things you need to know about it. So let me tell you the type of questions the examiner might ask you. So the type of questions that can be asked is first that is the vertebral level of the manubrium. Then they ask you the level of the sternal angle and its importance of the sternal angle. Then they tell why first costal cartilage joint is the cartilaginous joint. Then we have what type of joint is xiphi-sternal joint, and so on. So all the questions that can come in your exam, I'll put in the Telegram group. If you need the questions, like put it in the comment section. I'll put it in the Telegram group. So if you put your reviews, if you need the extra questions or extra cadaveric images, let me know in the comment section so that I can put it easily. I hope you like this video. In the next video, we are going to discuss about the ribs. If you like the content of this video, do like, share, comment, and just subscribe to my channel for more effective or more easy content to remember before your exam. Hope you like my video. Do share it. Till then, just to revise this complete content. In the next session, we'll discuss another topic. Till then, bye. Take care.